Good evening, Barbadians, residents of and visitors to Barbados. From the onset of the COVID-19 pandemic, we recognize that our public health laboratory, the Best Dos Santos lab, and our polyclinics would have been required to play an integral role in our response to the pandemic. Indeed, throughout the life of the pandemic, the Best Dos Santos Public Health Laboratory has conducted approximately 62,000 PCR tests, and that is for the 10 months or so of the pandemic. During the current month, we've been able to do about 12,000 of those tests, and within the last 3 days, the lab has conducted some 3,000 tests. Our protocol states that our test results will be returned between 24 and 48 hours. For the most part, we've been able to do this within 24 hours. And I think that this is a remarkable achievement for a small island developing state like Barbados. And I really take my hat off to the staff of the Best Dos Santos lab and those working in the polyclinics. We recognize also that once the winter season was approaching, that there would be a requirement to step up our game. We anticipated, obviously, that there would be a lot more arrivals, and we committed ourselves to providing additional resources in order to build the capacity that we envisaged that we would require for operations. And we did so. But during the last week, we've had some challenges because the numbers have increased significantly. And this has resulted in some delays in terms of the processing of tests and the dissemination of test results. Because of this, I know that some visitors to the island and some returning nationals have had to stay a bit longer in designated quarantine facilities than we would have envisaged or than they would have wanted to do. And this for us is indeed a problem. We are not going to sit back and say that this is something that is happening globally, although we recognize that in several countries that persons are not able to get back a test result within 72 hours, and in some cases even within a week. We have visitors arriving to our shores and they come here without the test result because they were not able to get the result that they would have paid for the 72-hour period. But that does not mean that we are happy with the current situation. Indeed, we are not. And we are not because we believe in excellence. We believe that we can do better. We believe that even with the increase in numbers, that we can still provide results within a 24-hour period. But in order to do so, we need additional resources. And so, the first step of the process was utilizing the collective wisdom of the persons within the Ministry of Health and Wellness, and under the guidance and the astute leadership of our Honorable Prime Minister, who've been assisting us all along the way, we've been able to gather some additional resources at the technical level in terms of the lab, and also for persons to do some data entry for us in order to alleviate some of the challenges. We've also rolled out an app called the SHAPE app, and this electronic app allows us to be able to do things in real time. And we have almost completed all of the training with all of the polyclinics to be able to get that system going. So we are really bent on doing better. And I am sure that in the coming days, that the situation as it relates to persons getting test results beyond the 48-hour period, that will come to an end. And I'm confident in saying so because I visited the lab today. I spent a few hours at the lab, and I was really happy to see that in spite of the backlog which would have existed for the past several days, that we were processing today yesterday's tests or yesterday's swabs. And that means that we've been able to catch up to a large extent, except for a few situations that we are still developing. So I can give the assurance that within a few days, with all the resources that we have now at our disposal, including the intent to take the lab to a 24-hour system by hiring additional staff and training additional staff, that we will be able to do what is required to be able to produce results within a 24-hour period. And so what I would like to do at this stage is to apologize to all persons who might have been affected or impacted by this. We tried. It is not a perfect system, and we are open to enhancing whatever we do to make things better, as we've been doing throughout the life of this pandemic. And so with that apology, I want to give the assurance to our visitors, to Barbadians returning, to those persons who depend on the lab and the system for those results, that based on what we are establishing right now in terms of establishing a special unit that will be dealing with this specifically, and with the additional resources provided, that we are going to overcome these challenges in the very near future, in the coming days. I thank you.
Good evening, Barbados. I'd like first to express the appreciation of the Ministry of Tourism and International Transport and all of the agencies that fall under the ministry, including the Barbados Tourism Marketing, Inc. and the Grantley Adams International Airport, as well as Caribbean Aircraft Handling, who have been working very closely with our partners in the Ministry of Health to ensure that travelers to our shores are able to benefit from the best possible service under the conditions, and that we have been able to do so in a way that is fully respectful of the protocols put in place by the Ministry of Health, and that we are able to ensure that we keep not just our guests safe, but we keep Barbadians and our country and people safe more generally. Over the last few months, we have been seeing since July and the resumption of commercial flights, persons coming back to Barbados and expressing an interest in escaping the challenges being faced by surging infection rates, surging death rates in other markets, and being in a position to enjoy all that Barbados has to offer. And in this instance, one of the things that Barbados has to offer, besides our traditional sun, sea, and sand, is very much a safe destination to which we have been prioritizing safe travel for a safe vacation. And safety means that we are working very closely with the Ministry of Health. Over the last few weeks, we have seen a significant increase in the number of visitor arrivals to the island. That means that visitors coming to enjoy their customary winter holiday, as well as Barbadians coming home to spend time with friends and family, have been able to come to Barbados because of increased capacity on our flights. We have had the opportunity to sit with the Ministry of Health over the past few weeks and to plan. We have looked at what the expected arrivals would be through January 15th, and we've looked at what the numbers are expected to be on a day-to-day basis. We've also had the opportunity to plan for how we can make a safe airport transition, how we can ensure that it is safe, it complies with the protocols, but it is also efficient and allows persons to be processed in the shortest possible time frame. Equally so, we've also worked very closely with the Ministry of Health to ensure that persons who have their second test are also accommodated as efficiently and as safely as is possible in collaboration with our partners in the hotel industry. But as you have heard from the Minister of Health, Minister Bostic, despite our best efforts, there have been capacity challenges in our laboratories and in our ability to turn around the tests, particularly our second tests in time for some of our guests. And we've also had the opportunity to identify what some of those challenges are, and we give the commitment to our guests, to Barbadians alike, that we are ensuring that despite these challenges, that we ensure we give persons their test results in a reasonable time frame, but that we allow persons, when they have completed their tests and completed their quarantine, to then enter our wider community, having been given the assurance that they are COVID negative. And I think that is perhaps one of the most important messages that we would want to share with Barbados today. Above all else, we are supporting our economy, we are supporting our tourism industry, but we are not doing so at the expense of the health of either our guests or our Barbadians. And certainly from the Ministry of Tourism's perspective, we are not filling beds in hotels at the expense of having to increase beds in our hospitals and beds in our isolation facilities. And we want to ensure that all of our guests feel fully confident that our health services and our health officials who are working 24 hours a day in service to you, in service to Barbadians, have your best interests and your health and well-being at heart. And we give that commitment as Barbados. That is who we are. Thank you. Questions? Your question?
I just want, for a Various Nation newspaper, I wanted to know if there was a shift in the position regarding a ban or any possible restrictions on UK travel, given all that there is.
The Honorable Prime Minister would have addressed this issue, and I also did yesterday, and I would have indicated that this is an ongoing situation. We are following what is happening globally in the United Kingdom. We are in contact with WHO PAHO, who is there providing guidance in terms of this particular one. And at this time, we do not see any requirement for the closure of our airspace or our airport to flights coming from the United Kingdom. And if the situation warrants that, we will give early notice to the press, and also we will make it known to the airlines who come here. But at this point in time, we're not considering that as an option.
And then secondly, as it relates to the quarantine or the hotel facilities, is there, do you believe that there aren't, the measures aren't strict enough that some of the visitors are able to do as they please? So for example, we got a report that a British tourist, they left the facility and they went to a bank. And that kind of had a still effect. So I don't know if you heard about that particular incident, and if you could shine some light on what the protocols are when they get there.
I haven't heard about that specific incident, but what I can say is that we spent a significant amount of time with the Ministry of Health, with the Barbados Hotel and Tourism Association, with all of the hotels, with the COVID monitoring unit led by Mr. Ronald Chapman, going over what is required of hotels on property. And we have also ensured that there is active engagement that is led by the Ministry of Health. From the Ministry of Tourism's perspective, we are very confident that the Ministry of Health is going to ensure through its COVID unit and through its enforcement mechanisms that the protocols are complied with. But what we would want to call on people to do, and we have been having these engagements with hotel workers and persons who work in the sector, it's the same thing as if you live in your community, you have a neighborhood watch. If you see something, say something. Alert the COVID unit. If you are concerned that a person who is on property is not wearing a mask, if you are concerned that a person who you know is in quarantine and is on property and is engaging in activity that they ought not to be, say something. And that is the role that is meant to be played by all of us, because we have a collective responsibility to keep our country and our people safe. And if there is a challenge, the Ministry of Health, certainly through their enforcement unit, has not failed to act when warranted.
Crystal for CBC News, more so for Mr. Bostic. What are the current penalties in place for those who do not adhere to our quarantine rules, and will we be looking to have harsher restrictions similar to the in Cayman Islands?
Honestly, I cannot tell you exactly what the fines are, but I can say to you that we have already prosecuted persons, and that we have not seen anything that would make us adopt a harsher stance at this point in time. Is about enforcing what we already have, but more importantly, like we do with all Barbadians, we do the same with our visitors and with those persons in the hotel industry. We ask persons to collaborate, cooperate, and if there's any issue at all, for persons to let us know so that we can respond to it. And at this point in time, I don't think we've been impacted in a negative way by anything of that sort.
Initially, some of the hoteliers were concerned that the Santos was going to close for the holidays. Can you speak to this?
The Best Dos Santos lab will be open on the 25th of December and for every day. And they've been doing that consistently for the entire year.
You spoke to a significant increase in arrivals. If the numbers have not been given already, Can you give me a sense of that number?
The numbers vary from day to day. As you would imagine, this is a fluid situation. And at December 2nd, for example, we were expecting that with the release of the previous lockdown in the UK, that there would have been increased demand from December 3rd, and we saw quite a bit of that. But then obviously we saw that the UK went back into lockdown, and you have seen some provinces, particularly the largest provinces in Canada, are equally going into lockdown. And so long-range projections are challenging, but what we can say to you is that on a day-to-day basis, we are monitoring the arrival numbers in terms of both projections and actual. And on a daily basis, it could range from somewhere in the vicinity of 400 persons up to just under 3,000 persons on a daily basis.
You also receive reports that some of the rates for the hotels are a bit too much for persons who are coming and they have to quarantine.
So what I can say to you is that the hotel rates, for the most part, are heavily discounted. And you would have most of the hotels who are charging at a rate that is sometimes, in some instances, 40 to 50% below their normal rate. And that is very much in keeping with what we're seeing across the industry in terms of tourism with hotels. But I also want to remind you that many of these properties have not earned any revenue for a total of 10 months. And we are calling on most of the hoteliers to reopen their properties to business and to ensure that they re-engage their workers. And so there has to be a balance struck between what is a reasonable cost for a hotel, or for any business for that matter, to operate, and then what is a rate that can service the demand. And so across all categories in the hotel industry, both in the budget category and in the luxury and the high class, A-class hotels, we are seeing not just heavily discounted rates, but also a wide range of options for persons at any budget level to make a responsible choice.
One more question for Minister Bostic. Can you speak with regards to the cost of the testing, since we've been doing the second test and doing so many more tests? And how many testing kits do we have still?
We still have an adequate supply of kits available on island. And of course, we have some on order because we are here for the long haul, and we have to prepare ourselves, even with the coming of vaccines, to make sure that we are fully prepared. So the costs really, for those persons who seek tests for travel, especially non-Barbadians, the Ministry of Health and Wellness charged a fee of $150 for tests, and that would include the swabbing, include the materials, and also the lab. So that is it.
150 Barbados?
150.
Good afternoon, Minister. Kareem Smith from Barbados today. Over the last few hours, we would have been informed about the existence of a COVID-19 cluster that originated somewhere on the West Coast. Perhaps about 24 hours prior to that, you gave an investigation in which you alluded to the fact that there was something at play, but you did not give, or it may appear as though you would not have shared the full story with Barbadians. Could you explain the rationale for that, please?
Well, I don't know why you would have arrived at that conclusion. At the time, we were dealing with 14 cases over a period of 2 days, and it did indicate that there was a particular situation which you are referring to that was under active investigation, and that once we have all the information, and if it warranted us coming back to the press and to the country to speak to that particular situation, that we would have done so. 3 persons, yes, and I did state that there were 3 persons and a family, and obviously there would have been some contact tracing in relation to that particular situation. And at that time, there was no telling as to what the results of the contact tracing would have been, so I could not give anything specific. I've subsequently indicated that all of the persons identified through contact tracing have been tested for our first test. All tests have come back negative. Those persons remain in quarantine until we do a second test. And they said that we are satisfied and we feel comfortable in the Ministry of Health and Wellness that this is not going to cause us any real issues.
Okay, final question. There's been concern on social media regarding a party this weekend in 2nd Street. Bajans are concerned that rules do not apply across the board to both Bajans and tourists.
rules apply across the board to everyone on this island. But I'm sure you will appreciate that our officials cannot be everywhere and at every time. And so we depend on persons, members of the public, to report when they see situations that they think should not be happening. We investigate. We have people on the ground from the monitoring unit that are going around and they're checking on things and trying to keep things stable. But at the same time, as I've said from the beginning, back in January, February, that this requires an all-of-country approach. All of us must be involved in this. And if persons see things that are happening that they really know should not be happening and that are in contravention of the protocols, they should let us know and we will respond to those situations.
Okay. One more person? Thank you very much.